Great. Well, greetings, everyone. We are emulating the hybrid nature of this meeting. Terrific community, both online, including listeners and speakers, as well as in person here. So wonderful to have everyone engaged in session 6. This is the Climate and Health Research Agenda, a Shared Path Forward session. I'm Ann Kurth, president of the New York Academy of Medicine. It's an honor and delight to be able to introduce briefly our terrific moderator, Dr. Zulfi, who is online. He is, as you all are probably quite aware, he is the founding director of the Institute for Global Health and Development at Aga Khan. He's also been a professor in about 6 universities on multiple continents. He has contributed a lifetime of research on pediatric and maternal child health, including in the nutrition space, community health workers, and received the Gardner Global Health Award just a few years ago. So thrilled to have him here. He's also co-editor of the NAM research report that was embargoed till midday today. It's now online, and you'll be hearing more about that from him. So I'll turn it over, but just for one moment of reflection to say, how easy it is to destroy, how much time and effort it takes to build. And I'm reflecting as we think about science, which is truly the engine. It sounds like a truism, but it's truly the engine of innovation and life-saving advances. And we want to continue that energy. There was a report that NAM did actually just at the end of last year. It's always done before every administration to give some guidance, but also this was to reflect on the U.S. biomedical research enterprise. This was a committee that was led by Dr. Al Reese, and it provided a snapshot of what research has done in the years since World War II and the engagement and investment in research for health in the United States, the return on investment, the advances in HIV treatment, cancer treatment, et cetera. We know that we need to continue that in this context of climate change and other urgent related health concerns. So let's turn it over now to our moderator and get going with our terrific session. Thank you.
Well, thank you very much, and good afternoon, all colleagues. I realize this is one of the last sessions of what has been a fantastic day. I'm joining you from Islamabad in Pakistan, where it is just past midnight. But I can see that the vigor and energy in this meeting is still very fresh. I'm greatly honored to be part of this. So we have a fantastic lineup of speakers who are going to cover the topic largely from the lens of health research. What are the priorities? And as you heard Anne say, this is the time for science to stand up and be counted, particularly in the context of this existential global challenge of climate change and human health and development. And National Academy of Medicine is at the forefront of this quest to improve our understanding and also fill some of the evidence gaps in this regard. I'll come back a little later in the session when we talk about the research report that has been released today, but it's my great privilege now to introduce our lineup of 3 speakers who I will introduce in the order that they will speak. They are leaders in this field, both in North America and globally. Dr. Maureen Lichtveld is the Dean of the Pittsburgh School of Public Health, and Jonas Salk, Professor of Population Health, Professor of Environmental and Occupational Health at the University of Pittsburgh. And she will set the scene in our session on providing some of the background to the context and the challenges that we face. She'll be then followed by Dr. Renee Salas, who's the founding director of the Cooperative at the Massachusetts General Hospital, Brigham, and she's also going to address the challenges that we face with leveraging health systems to build resilience at the current time against climate change, particularly heat, and how to deliver low-cost and accessible healthcare. And then our final speaker in the session is Dr. Toddi Steelman, who is the Professor of Environmental and National Resource Policy and the Vice Provost for Climate and Sustainability at Duke University. And she's there in person in front of you, and Toddi will speak to the enormous opportunity that we have for building a collaborative of universities in terms of advocacy, science, and also policy research in relation to climate. So without further ado, I'd like to pass the floor to our wonderful speakers, And perhaps, Maureen, you can kick us off.
Thank you. And Jessica has my slides.
Yes, they're just coming up in a moment.
Oh, great. I see them. Thank you. And I was going to say good afternoon, but it's good early morning for Dr. Bhutta. Welcome everyone to the session. It's my honor to kick off this dialogue around where should we go next. And as we reflect on what it really means and what words really mean, it's easy to see how climate risk is directly related to health risk and also related to economic risk. So the purpose of my presentation today is to show the interconnectedness of these three entities. Next, please. And so 2 years or so ago, when the world hit 8 billion people, I was asked what keeps me up at night. And usually I say, well, I want to make sure that my grandkids are healthy. But in this case, it was about what are the 5 areas or 4 areas that I really worry about in the context of climate. Infectious disease, extreme heat, food and water security, and poor air quality. I can't think of other 4 that are so prominent and so not only impact our health, but also impact the economic development of many countries, including the US, but particularly also lower and middle income countries. Next, please. And so one of the concepts that is increasingly becoming the forefront, not only of research, but of practical implications is One Health. And so if we know that the definition of One Health is the interconnectedness among health of the environment or the ecosystem, health of people, health of animals, and health of plants. So if you put climate and the climate risk on top of that, you could see how the additions of all of that is not simply 1 + 1 + 1 + 1, but it's really 1 + 1 + 1 + 1 might be more than 100 than it is 4. Also, we have a specific opportunity to learn that around animal health, often you see animal health as sentinels for human health threats. Next, please. And so here is an example. We know that the highly pathogenic avian influenza is often referred to as bird flu, was typically seen as only in birds and then some contact with humans. And so here with H5N1, we're seeing that cats, so from wild animals to cats, were infected, and the first series of cats were infected where it was mass and multifocal necrosis leading to that, whether it's the lung, the heart, the retina, and the brain. You see the microscopic scans of where the inflammation is. Next, please. But then we saw indeed, after cats were dying, there was a cat of the first 10 that we've looked at, that showed clinical symptoms of illness, but that did recover. And then there was a cat that was in close proximity of infected cats, but appeared to be fully healthy. Therein lies the risk for zoonosis jumping into and really impacting people and serving as a threat for people. Next, please. And so if you could continue to click, we know that genetic reassortment occurs. What has happened with H5N1 is we almost skipped some steps, and we went all the way from cow herd infection, transmission, through traveling through the rest of the country to infecting primarily workers, although we have 2 deaths from H5N1 not related to the cow's transmission. Next, please. This is Pennsylvania. I live in Region 4, Allegheny County, and you could see that in Allegheny County, there are 25 locations where you can buy raw milk. And so you ask yourself that public health question: how could we sell this when we know what the risk is? So clearly a policy issue and an economic issue connected. Next, please. And so here I'm taking you to a country where I come from, in Suriname, and we have contaminated fish because of gold mining, mercury-related gold mining. So whichever climate driver you take, whether it's higher temperatures or less precipitation or more precipitation, the bottom line is that more fish get contaminated, and more fish, and therefore more people were contaminated. This is an environmental cohort study that I led of 1,200 pregnant women, and indeed we saw very highly elevated mercury concentrations. But here is what was different. As we look downstream from the gold mining, that's what anticipated. But what we also found is that one of the study sites where we were upstream of the contamination, where we saw extremely high levels in fish and extremely high levels in people. So how did the mercury get there if it wasn't from the gold mining? So clearly you see that changes in wind direction, because there's also mercury contamination in our neighboring country, in Brazil. So it is changing in direction and wind direction that had a deposit of mercury at a greater impact than it was even downstream of the gold mining. So think about the impact of climate on people who are not necessarily connected to this gold mining related contamination. Next, please. A similar situation is with, and this is food security now and food safety. A similar situation we see whether you have high temperatures, less precipitation, or more precipitation. You can work through all the arrows, and ultimately what you get is the increased pesticide residues in produce. And that did two things. One, the ground was less fertile, because of, in this case, either less or more precipitation. So people moved their little farms upstream, where it was less fertile, so lower yield, and therefore more pesticide use, and therefore also lower food quality. And so you could see the impact of climate change going through the food system. Next, please. And then I'm taking you to a set of islands in the Caribbean, where through the Pan American Health Organization was a support for what's called the development of smart hospitals. So smart hospitals are hospitals that were developed or were strengthened and were made more resilient against climate-related or exacerbated severe weather events. And so if you look at two countries, Guyana and Jamaica next to each other, if it's perhaps tough to read, just look at the colors. After making it more resilient, after smarting, so to speak, you see more green, and so better protected than in Guyana than you see in Jamaica. What we then did, and I can't share all the data yet because we're about to publish it, is we then looked at the continuity of diabetes care, smart versus not so smart. And indeed, we saw differences there as well. Next, please. So let's look at economy now and the economic cost. You see both the cost in people's lives, but you also see the cost in all that the hurricanes, or in this case, have resulted in. And so it makes absolute sense for us to address climate-related impacts, both from a cost in people's lives and a cost in plain old economic development and the economy. Next, please. This gives you a sense of cumulative climate finance needs versus the losses that we have. And you see, if you just look at a slight change in temperature, what that loss will be. And you could see that on the right-hand side, that loss in billions. Next, please. And so what does this mean? We are so used to focusing on only the individual cost and the individual impact. But if you look at the research that tells us that 80 to 90% of the impact is at the community level. And so addressing only the individual impact will not let us address the true impact of what climate health is causing. Next, please. We cannot do it alone. We cannot sit in, our research effort offices and do that. It is critically important not only to take a transdisciplinary approach, but also to do that with co-designing it from the start, in addition to from co-designing, co-implementing, all the way to dissemination. And one area of science, I'll come back to what the research needs are, is implementation science, so that we can make a difference on the front line. Next, please. So this was an interesting article, and I took a couple of times to read that because it says, well, what's the economic impact? If we look at adverse events without climate variability, has caused, even without it, has caused famine and food crisis. And how then is our question, how would climate potentiate those impacts? We know that studies are lacking in many lower and middle income countries, but what incentives are there to focus the impact of climate on crop yield in LMICs? So what incentive is there for the developed countries to focus on that? The third area is the embedding of degree day variables rather than looking over time. So how do we do that? How do we characterize that and the differential impact of heat accumulated throughout the growing season, not only one specific, not looking at throughout the growing season, but also one specific day? How does climate-induced exacerbated pollution impact crop yield? And so you almost get a triple whammy on crop yield. And if we talk about crop yield, I mentioned that already. It's important because we need to have, we'll deal with food insecurity, but crop quality is equally important because that is one of the major drivers of malnutrition in many lower and middle income countries and pregnant women and 0 to 5 years old. Next, please. And so within Pennsylvania, I think we are the only school of public health currently that's leading the Pennsylvania, the state's One Health Consortium in these 4 areas of research, education, policy, and community engagement. And I'm making advertising our first ever One Health Consortium meeting. I hope that many of you will participate. It's 26th to 28th of June in Harrisburg. Next, please. And I should be ending soon. And so what's the bottom line? The bottom line is 4 areas of research that I'm proposing to move forward. One is that research innovation has to be connected to being practical, so therefore implementation science. Second, that we focus on the 3 areas of precision public health: predict, prepare, and prevent. Third, that we could start both ways. It's bidirectional. We could start with climate drivers and the impact on health, or we could start with health and how climate drivers impact health. Fourth, that we need to go across the continuum from bench to what we do in the translation perspective and then to populations. And then lastly is that we know that the impact of climate knows no borders. And so we cannot do that country specific, but rather look at it as a global enterprise. Let me stop here and thank you.
Well, thank you very much, Maureen, for setting the scene and for giving this comprehensive overview. Let me now, without further ado, pass to you, Renee. And I know you don't have slides, but the floor is yours. We could take these slides off. Thank you.
Well, thank you so much. And thank you to the National Academy of Medicine for hosting this event. It's truly an honor and privilege to be speaking alongside these esteemed colleagues. And I'm excited for the launch of the Climate and Health Research Agenda. So these brief comments are framed as reflections on some ways that we can turn the agenda into on-the-ground reality, both as individual researchers and collectively as a community, using heat as an example and really expanding further on some of the ideas that have already been elevated, including throughout the day. So I recently met with a researcher obtaining her PhD who wanted to root the thesis in the nexus of climate change and health. And they asked me this question: what research area can I lean into that will have the greatest impact? Now, I'm sure many of you have had similar conversations, and it's a loaded question with many follow-up questions. But I think an important one is that I like to ask is, how do you define impact? And how does the broader we define impact? I don't know anyone who works at the nexus of climate change and health who wants to do research for the sake of research, right? We want our work to matter, to improve lives and to shape a better future. Well, in November of 2024, the Pew Research Center poll showed that only half of some US groups believe scientists were focused on solving real-world problems. That means half are not. And herein lies an opportunity for a shared path forward. So a call to action that you will see reflected in the agenda and our discussions. So in my experience, research that's grounded in real-world problems is what drives the greatest impact, especially when it comes to climate and health, where the needs are growing. And unfortunately, as we've heard, resources are becoming more limited. And this reflects what applied research is all about: working together to create real solutions to real-world problems. And this approach can serve as a guiding principle, one that helps us integrate the diverse domains being discussed here and reflected in the research agenda. So breaking it down, first, real-world problems are complex. It means problems can't be simply categorized as just a climate issue or a health issue or a social issue. They cut across all of those and touch on all aspects of our lives. And that means understanding doesn't come with assumptions or from a distance. It comes from listening to and working alongside the people you're trying to help. It requires local engagement and partnership, where everyone brings expertise. And often those with lived experience can offer the most powerful insights, because those closest to the challenges are often closest to the solutions and can best recognize potential unintended consequences or trade-offs. So this means not only including community members in part of the process, but the whole process, and even as authors. Second, for solutions to be effective, they need to be actionable and overcome real implementation barriers. We need to understand these barriers early in the process by bringing in those who are actually going to be using them and implementing them. And effective solutions also need the right infrastructure to support and sustain these changes. So allowing us to confront the problem at a systemic level, not through short-term fixes. So this includes important levers like policy, finance, public engagement, really all aligned to support and scale specific solutions. This means broadening who's at the table from the start, like policymakers, economists, communication experts, behavioral scientists, and implementation scientists. It becomes interdisciplinary, cross-sectoral, and community-centered, grounded in what people need. And there are so many examples emerging of where this is being done well, and we need to elevate those. But we also need to build structures that can make this work easier, which is an area I focus on. Because this kind of partnership takes time. It moves at the speed of trust. It requires coordination, strong leadership, and a common agenda for people to work collectively. So to briefly apply this to a real-world problem, a recent research study was examining Virginia and found that communities that had cooling centers had higher rates of heat-related illness than those without. So again, just to reframe that actually communities that had cooling centers had higher rates of heat-related illness, with the greatest differences seen in urban areas. So the authors, rightly so, noted that this prompts a number of questions as to why. Do community members know about cooling centers? Are they using them? Why or why not? How can this be improved? What solutions do communities want to leverage and implement? leading to questions like how can healthcare systems help fill these gaps? What kind of data is needed? What policy is needed? How can new technologies help? Working continually outward, these questions can create a roadmap of how to really understand the problems our communities are facing and to really co-develop the real innovative solutions needed to address them. Communities, public health, healthcare systems, other sectors and disciplines really working side by side to develop local integrated solutions. And this process may lead to some unexpected places, but that is by design and means you are uncovering research questions and solutions that are innovative and matter. So back to the original question of what research will have an impact. Well, there's no shortage of problems that need solutions, as you've heard. So in my experience, it can often sometimes be less about what and more about how. Research grounded in real world need, developed in partnership with communities, driven by the people working to solve those problems. Because in the end, impact looks like this, working together to create real solutions to real world problems. Thank you, and I look forward to our discussion.
Thank you so much, Renee, for those insightful remarks. And let's now turn to Toddi Steelman. And Toddi, the floor is yours to tell us a little bit about the initiative that you are playing a spearheading role in. Thank you.
Very good. Thank you, Zulfi. Thanks also to the National Academy of Medicine for the opportunity to be here today. I am speaking on behalf of a group of scholars from the Global North and the Global South who convened in November as part of a convening at Bellagio, a Rockefeller convening that considered how we might play a more active and significant role given the challenges we face when we think about climate, health, and equity. And I'm very pleased to say that Zulfi is a co-author on this paper, as is Bill Tan, who is here today, in addition to 18 other scholars. So I just want to make it clear that I'm speaking on behalf of all of those good people and that Gerard Radivosian is the lead author on that particular paper. So I want to set the stage. And this is sort of a big picture. What is the role for universities talk? Climate change is projected to cause 1.4 million additional deaths and 12.5 trillion additional economic losses by 2050, according to the World Economic Forum. The elderly, youth, women, disabled, lower income people, and remote communities will be disproportionately affected. And Africa and Southern Asia in particular are vulnerable due to existing infrastructure and resource inequities. The urgency that we feel, I think, as someone who really cares about climate change, as I expect is everybody else in this room, human-caused warming is increasing at unprecedented rates. Projections are between 1.4 and 4.4 degrees Celsius, depending on the actions that we take, according to the IPCC. It is absolutely essential that we engage in both mitigation and adaptation. We have to slow the rate of carbon emissions. That's absolutely crucial to prevent additional catastrophic consequences. And absolutely everybody needs to do their part in this effort. Globally, health systems contribute about 4 to 5% of global emissions, greenhouse gas emissions. In the United States, it's about 7 to 8% of US emissions. And if the health sector were a country, it would be the 5th largest global emitter, according to Healthcare Without Harm. So we face 3 converging crises right now that are affecting health sector and universities. In the US, we face a federal funding crisis and cuts to health and human services programs, to community health centers, to NIH research. That we anticipate will have a generational effect on healthcare. At the same time, international aid is under assault. Within the United States, the withdrawal from the World Health Organization and the dissolution of USAID has more than 5,000 grants and contracts worth over $27 billion cut, affecting support from food assistance to HIV to maternal health and support. Also severely damaging the United States' standing in the world. And then finally, funding freezes at universities include billions of dollars in grants and contracts, threats to the tax-exempt status, held by universities and a more hostile environment for international students, as well as investigations and enforcement actions targeting 60 universities by the Department of Education and 10 by the Department of Justice. So the universities are in the crosshairs right now. I don't think that's a secret. I think it's really important for us to ask ourselves, why are we seeing these actions? We're witnessing, I believe, a battle over ideology and the role of universities in society at large. We're seeing political strategy to deal with perceived woke culture and policies and the liberal biases on campuses. We're seeing an effort to reshape the regulatory environment that shapes higher education, including funding, admissions, and campus activities that really threaten universities' independence, autonomy, and free speech. And I think it's really important for us as people that either are at universities or care about universities to actually hear these criticisms, as difficult as they may be, because there are seeds of truth here. Doesn't mean it's all true. There's some deserving criticism here, and there's a lot that is not. Because we have to better understand how we can serve society at this moment. We are really being called to the carpet on these issues, and it is up to us to respond. It does not mean we abandon our values, but it does call for some introspection on our behalf. So it's important for us to lean into the strengths that universities possess and reassess what we can contribute at this time. We are not the private sector. We are not the public sector. We are not the philanthropic sector, and we are not the nonprofit sector. So what is it? What are our superpowers? What do we bring to the table? First, we generate new knowledge, and this sort of starts to get into the slide. I have only one slide, and that's what you see up there in front of you. Universities need to leverage their intellectual freedom and our opportunity to lean into long-term inquiry to address climate and health research. We have the luxury of being able to take the long-term view because we are institutions. Institutions like Harvard have been around since before the United States was a country. We have institutions of higher education that date back to the 12th century. We need to push the boundaries of discovery science and implementation science, and take risks that focus on communities in ways that our for-profit members of society cannot. We need to provide the basis for evidence-based policy, and we need to counter misinformation in a post-factual world, because science, evidence, and facts actually mean something, and we have to stand up for that. So at a time when suppressing unpopular views is common and increasing, universities have long been a distinct societal voice for protecting scientific integrity, providing protection from censorship, encouraging diverse perspectives, and supporting critical thinking. And those are strengths that we need to continue to lean into at this moment. We also foster collaboration, including cross-nation and cross-sectoral networks that enable widespread connection, ideally supporting equitable, more holistic, and integrated climate health interventions, much like Renee addressed just previously. Universities also bridge the gap between academic research and practical application when we engage with policymakers, normative bodies, non-governmental organizations, the private sector, and other stakeholders. We are conveners, and we also need to continue to play that role in a very courageous way at this time. We form partnerships between the Global South and the Global North to empower vulnerable and marginalized voices, and this has probably never been more important than at this moment. Universities create and coordinate multi-country and multidisciplinary climate consortia, and this is what we need to do. My third point, institutional responsibility. Institutions, and this is several areas, we have a commitment to academic inquiry and evidence-based science. We serve local communities and tackle inequities. We address ethical issues related to research and services. And we need to address our own greenhouse gas emissions and sustainability challenges that take place on our own campuses and with our own healthcare systems. So universities are really great because we have our own laboratories in our own backyards where we can demonstrate sustainability practices, whether it's with our physical plant with energy use, with waste management, and our own academic health systems. We also have enormous opportunity to demonstrate commitment to equity by embedding and working with communities proactively in our own backyards and globally, as well as addressing ethical considerations in research interventions and health burdens. And then finally, in terms of the role we play in education, we need to integrate climate and health across our curricula to help and equip students to the challenges that they will all face, regardless of the career they go into or the major that they undertake. We need to prepare them with the knowledge and skills they need to engage in this warming world. We also need, and I think Renee really covered this particularly well, the opportunity that we have to combine clinical research, education, and operational attributes on campuses in ways to address the climate and health challenge. So I'm going to leave you with the call to action, which is the urgency of addressing climate change and its health impacts necessitates strong leadership, collaboration with communities, partnerships between the North and the South, and the ability to generate actionable, evidence-based science and solutions. Universities are uniquely positioned at local, national, and global levels as civic leaders to contribute by leveraging our own strengths in interdisciplinary research, education, outreach, and knowledge to drive transformative change. We need to rise to the challenge before us. I think we have shown some shortcomings, and it's an opportunity for us to really demonstrate this now. Climate change is not going away. Science doesn't care about what you believe. It only cares about the facts. So I think it's really important for all of us to get to work. Thank you.
Well, thank you so much, Toddi, for that most insightful statements and a call for universities to act as the social, societal conscience, to be the place for critical thinking, ethical decision-making, and also a voice for social justice. Well, let's get into the discussion. I would ask the audience present in the hall to ask questions, and we are counting on NAM staff there to filter that to me so I could direct them appropriately. We also have a Q&A portal for those who have joined online, and although you can't ask questions live, please post them in and the staff will also direct them to us. But let me start by perhaps asking from my perspective, and in the order that these concepts were shared, you, Maureen, from the point of view of climate change and global health and development, you gave us some very sobering stats for the US by and large. We also spoke to the extent of this being subnational, figures from various states. How much do we know about the global cost of not doing something about climate change and now not investing in evidence-based solutions? What is the overall impact of climate change if we did not address it scientifically and appropriately at a global level?
So let's start with, thank you, Zulfi. Let's start with the money part. The money part is in billions of economic products, in billions of people starving, in billions of forced migration, in billions of less productivity in the agricultural area specifically. It's in billions in hospital costs because people with, particularly children with asthma, have exacerbations, whether it's here in our country or in other countries. And so even if you limit it to the economic perspective, it is not only a threat, it's one of the highest priorities in public health. There is no higher priority for me. If you look at it through the lens of human lives, particularly in lower and middle income countries, but also in our rural areas, whether you look at it from a maternal and child health perspective, or people with already existing chronic diseases with comorbidities, the cost cannot be compared with anything than, even if you look at it through the small lens of healthcare costs, and that's why I shared that precision public health outside. If we are unable to address the $5.3 trillion that healthcare is costing now, we will not be able to address the additional cost, the synergistically higher additional cost to healthcare related to climate and climate-induced diseases.
So what I was trying to ask, maybe diplomatically, which I can ask you now pretty bluntly, is in this entire quest of trying the world to engage with the United States on the economic front by increasing trade, bringing production to the US, if climate change is unaddressed as a barrier, how will that development agenda work? Unless the entire world prospers economically, for which climate change is such a fundamental barrier, particularly at a continental level where you and I come from Asia, from Africa, is that economic agenda even viable for global development?
It's people fall on words, and both Renee and Toddi brought it up. Frankly, I don't care what we call it. If there is a driver that impacts our pocketbooks, that impacts the economic well-being of our world globally, then it makes absolute 1,000% sense to address that driver. And whether you call it severe weather events or environmental toxins or hurricanes, it doesn't matter to me what you call it. What does matter is that we address it the same way we would address any other economic impact.
Well, thank you. Let me turn to Renee and ask you, what guidance exists in terms of addressing the implementation science of climate change research at either national or subnational level in the US? I mean, it is perhaps clear to many people embedded in the field what implementation science here means, but I'd like to have you maybe address, are we talking about implementation science within the health sector, or are we talking about cross-sectoral initiatives or multi-sectoral initiatives where we need also a similar approach that we have for implementation science within disciplines?
Yeah, thank you for this great question. So as an emergency medicine doctor, I see a patient, identify their problem, and then I consult specialists who I bring together with which to be able to solve that problem collectively together, everyone bringing their unique expertise and their unique resources. So if we take a problem-based approach, which is where I really embedded and I guess rooted my remarks, then we go wherever the solutions lead us, which is inherently a cross-sectoral solution approach, that we identify where are the needs, what's working well with what's currently there, what's not, how can we leverage other sectors? So thinking about public health and communities right now are really bearing the burden in the United States and in many communities around being able to respond to these accelerating climate-related events. So how can we leverage the powerful resources of healthcare systems to help augment that? How can we then tap into other resources from government? How can we tap policy levers, finance levers, and other sectors like energy grids, for example, to really help build kind of these integrated solutions? So I also, though, and I want to go back also and recognize you initially touched on evidence-based guidelines. And so, climate change touches everything, right? You've heard that here. And so I often think about it from adding a climate lens. So how can we really view whatever it is we're looking at on how climate change is impacting that now and how will it in the future? And I think this is especially true for solutions. So I think being able to leverage evidence-based guidelines around implementation science from across disciplines and really adding that climate lens and really building a holistic picture where each of these can lend respective expertise and resources and insights from their unique perspective to really build that whole picture. So we're all kind of touching the elephant from different sides, but if we can bring all of these pieces together, then we can really create integrated holistic solutions that do solve real world problems with real solutions.
Actually, I'll follow up on that because Daniel Enkra has asked a comparable question, which covers part of it. And what Daniel asks is that, real world research is a very broad theme. Is there an effort to provide granularity in terms of specific areas of research? I mean, as an emergency physician, I mean, do you have a list of top 10 questions that have to be addressed through research for climate resilience and adaptation?
Yeah, so I mean, I think, well, I look forward to the forthcoming research agenda, which I know has really helped map out some of those areas, but I will not steal the thunder there. And I think from my standpoint, it's really the problems that need to be addressed most are, again, those that are really plaguing our communities most. And so looking at from a health impact framework, for example, heat and air quality, they interact, they compound each other. And there is enormous, not only morbidity and mortality associated with that, but there's also solutions that we know about that can really be scaled and integrated into a local context to really begin to address some of those. So I guess I'm not trying to, shy away from the problem. I would put that at the top of at least my agenda and where are areas that we can really lean into and focus now. But I would also say that taking a step back, I can't give sort of one research agenda or why I should say one area of focus for each location. It's really going to be location specific. And so that's really leaning into that community and figuring out what are those greatest needs and where's the energy and the resources to address them.
So Zulfi, if I can add to what Renee said, it should be by doing collaborative research, that by design, it should be what the communities identify as the top priority. From a mass scale, those are the four that I identified: infectious disease, food security, air pollution, and water pollution. So water quality specifically. But if you look at Africa, if you consider Africa, definitely food security and food quality will play a major role. If you look all over the world, anything that impacts the agriculture, whether it's heat or flooding, will play a key role. But it's truly what the communities impact, what the communities risk are, that should drive the priority. We can't set those priorities for any specific community.
So it's contextual knowledge and contextual implementation. Now, in the final phase, I'd like to give the floor to Toddi, because you covered a very broad area and a very important area. And I'd like to pose two linked questions to you as we finish the Q&A part of this session. So Toddi, what are the unanticipated consequences of what has emerged from the US disengagement, particularly with the Paris Accords and the global climate financing agenda? How might this, in your opinion, and are there any models that indicate the economic cost of doing so down the road to the US? Would this come back to haunt us in some ways? And then there is a linked question from Priyanka Fernandez, who has asked that, is there a need to radically reimagine research also and look at upstream investments that might give you the best return for your investment? So in some ways, how are universities dealing with the best buys for climate research at this time when resources are limited? And also, unfortunately, as a consequence of some of these recent decisions, researchers will be limited. So please, over to you.
Thanks. So about the unintended consequences, we're in the very early days. It is April and the new administration came in January, right? We're 3.5 months in, and there's going to be a lot of continued consequences, I think, that flow forward. But based on sort of where we are, at least right now with what's happened, I think the cuts to funding will have a generational influence on this cohort of young scholars and professionals, everything from doctoral students to postdocs to early career professionals, because of disruption to funding. So for instance, you're going to have graduate students who are in year 2 or 3 whose funding has just disappeared. What do? Do they have sufficient data to complete their degree? Do they keep going? Do they not keep going? Do they pick up another degree? What do they do? So you've got stranded students in process. You have postdocs who are out looking for jobs. I have a postdoc who had 2 appointments, basically interviews, both of which were canceled on the same day. Just jobs have evaporated. And that's just one example of what would be, multiple ones. And then we have young, early stage professors who no longer have funding streams that are going to be viable for them into the future, right? They were hired on a premise that there would be a certain amount of either health research, climate research, energy research, ecosystem restoration research, all of which plays into the One Health agenda that Maureen was talking about, that is very questionable in terms of where and whether it will be out there. So, I think we're looking at a generational challenge in terms of the cohorts that are out there right now. I think there's also been a considerable blow to American soft power in terms of influence that we wield internationally. And I think it's most emblematic of what we're seeing with USAID funding. When you have withdrawn from research studies in countries right now where people still have medical implements embedded in their bodies with no way to get them out, you are not a good citizen. You are not, playing a responsible role in society. So that level of disruption, removes an arrow from the diplomatic quiver that we have to wield soft power in the world, and ends up basically having us being seen as a bad actor. So I really worry about what that happens. Those are two, and I'll leave it at that. And when we think about reimagining research and what research should be at this moment in time, I'm going to come back a little bit to what both Maureen and Renee have emphasized in terms of the contextual nature. We have to imagine that research where we are and how best we as universities, and I will say as civic institutions, can be in our respective societies wherever we are. And that doesn't just mean our localities. We have presence in many other places globally, and how we behave in those areas as well. And so I think that the larger incentives that we have at universities do not lend easily to our ability to engage in co-knowledge driven collaborative research agendas. When we look at our tenure guidelines, when we look at our incentive systems, they're not really set up to encourage that kind of research and engagement. And I think that is something that we need to go back and reimagine as institutions at large, and we will be more effective if we do this at an institutional systematic scale than one institution at a time. But what would the world look like if universities were more engaged and were rewarded for that level of community engagement? I think that's a future worthy of greater consideration.
Absolutely. And that's something which has been a dominant theme in many sessions and discussions about finding ways to continue to do what is right and continue to speak for the truth and to speak for this as a global community of thought leaders and academic centers which are not located or restricted to any one geography. So, ladies and gentlemen, we have to move on. And because I have the enormous privilege of introducing the National Academy of Medicine's research agenda, I realize that there's still a couple of questions out there, and I would encourage our worthy speakers to perhaps try and address them if you are online or otherwise directly with people who have asked those questions. But can I request the NAM organizers to put on the research report slides, please? And I'll just briefly talk you through this and see if people have, given that it was just released today, had a chance to quickly glance through what that enormous body of work is. So this research agenda or report from the National Academy of Medicine, I was greatly honored to co-edit that with our president, Dr. Vic Rao. It focuses on what is a research agenda for NAM in addressing human health in the face of climate change, but from a resilience and adaptation perspective. It is conceptualized to be a document that would help advance our understanding and also guide policy and practice broadly to protect and improve human health. It was very important for this report to also underscore that there are significant gaps, and these are the gaps that we need to prioritize in some way to better understand the complex relationship, interactions between climate factors and health outcomes. This was a multi-phase process, and I must highlight that this was a collaborative initiative between the National Academy of Medicine and Kaiser Permanente, who were partners and helped support this initiative, and many, many other academics, including some within my own group, who I will speak to in a minute. And therefore, it reflects months and months of efforts by many. And I'm very grateful to many NAM staff who spent hours developing this and also reflecting on what many people had said to include it in the report. So this multi-phase process had several important components. Inclusivity, bringing up all the voices from the grassroots up. Community voice, as some of you have said, was very important. Did it reflect many of the things that we had learned in the more recent past about diversity, about the fact that people sometimes can be marginalized by some of these global crises? It also needed to be comprehensive, to reflect a research agenda for everybody. And it did not really have to focus on any one element like implementation only. So it also included very comprehensively the discovery science that we need in trying to understand the impacts of climate on human physiology, on biology. The report relied on a very comprehensive literature review and also convening and feedback from many people. So it's basically a product of both a look at the evidence and science out there and also a Delphi process of engaging people, and then an interactive process of validating the research agenda and eventually leading to a portal where there's evidence and tools will be available. The research agenda covers a broad range of topics related to the intersection of environmental factors, climate change, and human health. And let's go to the next slide. So the 5 phases that were envisioned as part of this research agenda development, as I've already mentioned, phase 1 had interviews with a lot of climate experts and leaders to gather insights and perspectives. Phase 2 was a wider group of stakeholders and interview syntheses and literature input. And the phase 3 has been around virtual convening to create a platform for additional discourse and identifying research gaps. And now that we have this report, we are looking at not only sharing this report with all members of the National Academy and others, but also creating opportunities for placing this for wider societal discourse, a web portal for making the information available, and also a potential formal launch in the months to come of the report per se. I should, however, point out, go to the next slide, that the report is not only just restricted to this. We've had the great opportunity of also looking at this from the global lens of parallel exercises, trying to identify global research prioritization. And our own group in Toronto, the Aga Khan Network, has been quite engaged with the National Academy of Medicine, who were part of the first consultations in Dubai in 2023 and subsequent consultations leading to a convening last October where specific research questions were identified. And if you can just keep on going, they're close to around 300 plus research questions that have been formally identified and scored. Keep on going, and they have now been part of what a CHINRI process is that's hopefully going for publication. Next slide, please. So to summarize what the overarching domains are in this report, and I would encourage everybody to look at this report and to give us your feedback in terms of what you think are things that we need to modify and improve upon. As you can imagine, this report was largely drafted at a very different economic time, when there wasn't the concern that we have all expressed around withdrawal or limitation of resources. So quite importantly, the important domain of the report is exactly around what Maureen identified, is the impact on economic outcomes, certainly in our own geography. And I believe that some of that has ramifications in terms of global estimations of climate impact on economic outcomes, whether they relate to infectious diseases, air quality, food security, or climate-related migration. And indeed, I would say the interface of climate and conflict. It also looks at research needed to identify cross-cutting strategies to improve climate resilience and infrastructure adaptation, mitigation, equity in action. So obviously it relates to what needs to be done within health system, but also within communities for building resilience, addressing vulnerable populations, and through the lens of interdisciplinary research and implementation science. There is a focus in the report on what needs to be done to strengthen and enhance the research and technology infrastructure and capacities to address this, harnessing new technology, building a climate-savvy workforce, and identifying funding mechanisms. And I would perhaps underscore that, say we need to have innovative funding mechanisms now, which are not only dependent upon public resources, but also dependent upon civic society, philanthropy, and mechanisms that are bit more resilient to the political winds. I think this is going to be huge. As Toddi has said, our biggest challenge for some of these recent shocks are not what you're going to feel over the next few months, is what this is doing to confidence of people already. My daughter is doing a major in public health in Boston, and she's got a major in climate. She asks me, what is the future if there's going to be no funding in climate and no jobs in this area? So these are extremely important. And lastly, I think the report offers an opportunity for public and policy communication, education, and engagement to build that groundswell of support for enhanced research financing for climate and resilience. So this bidirectional nature of education and public engagement, I think, is a very important part of the report. And as I indicated, over the next few months, while this report goes on a web portal, and there's also an opportunity for feedback, I really hope that NAM will try and organize a more formal launch of this report down the road, where we would have an opportunity for a very focused engagement for a longer period of time than we have had today. So thank you very much for your attention and time. And I'll pass this now back to my colleagues at NAM for announcing the next transitions and possibly a break. With my profound regards and gratitude to all the speakers in this particular session, and also to Anne for making the introductions and getting us going. Thank you.
Thank you so much, Zulfi. We really appreciate you moderating this panel when it is quite late for you in Pakistan. We do actually have a few more minutes before we go to the closing plenary. And so I thought we could ask for maybe 1 to 2 questions for those in the room. We've been answering some online, but if that's all right with you, Zulfi, we'll just take 1 to 2.
Please go ahead and read them out.
So if you could line up, there's a microphone on that side and a microphone on that side. And I see 3 people answer all 3. I'd like to give some time for folks in the room. So first I'll turn to you, Phil. Thank you so much.
Thank you. Thank you for the presentations. Phil Dolan from Johnson & Johnson. One area, and this is not based on evidence, but that seems under-researched to me, is the impact of climate change and other environmental factors like air pollution on our current medical interventions, right? So how does things like extreme heat impact pharmaceutical interventions? How does it impact surgical outcomes? How do things like extreme weather impact, oncology care and so on? And it seems like that doesn't get as much love, those areas. So I'm just wondering if anybody could comment on that.
Yes, I think I will start, and I'm sure Renee will follow up. What we're lacking is on the training and of the knowledge and skills of not only our currently practicing providers, but also those that are coming on board. And so our team is working on a very simple how to take a climate and health history. Because if you do that, then you'll find out how heat impacts or air pollution impacts asthma. Or what the impact is. And there was a recent article that showed that some exposure to contaminants, particularly volatile organics, actually intervene with the effectiveness of chemotherapy, because you mentioned oncology as an example. And so these are real world issues, fact-based issues, but our providers are not necessarily trained to ask the question.
Yeah, and I will just add on that. I know very briefly we want to cover a lot here, but it is a critical area of understanding because we know that climate change is redefining how we deliver clinical care and how healthcare is delivered. And so we need to understand that in a way that can drive solutions both within the healthcare system, but also make sure that the tools that we're developing are ones that can actually be implemented into existing workflows. And so that way we can use implementation science and harness that so we can monitor and evaluate those in real time to continually refining and again, meeting with the community to make sure that it is addressing and helping to augment existing interventions, whether it's in public health or community. And of course, as Maureen said, equipping individuals to incorporate that climate lens into all they do.
And actually, we're going to propose a two-pronged approach. One is not only to educate the providers who are currently in practice, but also to use the time, the wait time that patients have, you know how long patients wait, in the waiting room to answer questions. And so when that clinical encounter happens, it's effective because the patient has already gone through answering some of the questions that you would want to ask in a general anamnesis. And so that then interaction becomes much more effective. But I also should say in terms of implementation science, a couple of years ago, a group of us did an article to look at how you do implementation science in a co-design, co-implementation, co-assessment, co-publication, and co-dissemination strategy. And I'll be happy to share it with the NAM staff as a follow-up to the audience.
Thank you both so much. We'll turn to the next question, Hardeep. And I just wanted to note that Zulfi had to sign off, but we have 2 more questions and then we'll conclude.
Thanks, Jessica. So my name is Hardeep Singh. I'm a general internist and a quality and safety researcher. So I'm a health systems or a health services researcher. And I realize this report is mostly about sort of the climate impacts on health and adaptation and resilience. And even though there's a little bit of a sprinkle on implementation science, but I'm wondering if there's room for another report maybe on healthcare delivery system science, because given the fact that there's so much of emissions from healthcare delivery itself, 80%, we don't know a lot of these sustainability practices. So how does that research fit in where, clinicians, for the example, Renee's question was about the ER. Well, what does a sustainable ER look like? What are the best processes and systems and technologies, and how do we make sure that those are sort of implemented in real world practice? So I'm just thinking, I think this is a great start, but we actually need a separate report on healthcare delivery system science. Thank you.
Yes, Toddi is going to respond.
I think that's a terrific observation, and I can't speak to, what a report on that would look like, but I think we have an opportunity at universities because we have our own living labs, especially when we're attached to healthcare systems, of carrying out that exact kind of research, right? So how can we understand from what's happening in our own backyards and create that lab of seeing what's happening in one OR relative to another? Can we create master's projects? Can we create learning environments where we actually are undertaking that kind of research? I think it's a really exciting proposition.
Let me add that what we are currently doing, we have offices of sustainability both within the health sciences at the university and as well as our school. And here are students learning about how to create green laboratories. What do we do with our pipettes? What do we do with all the gloves? And so from a sustainability perspective, that's truly happening as well. But how it impacts and ultimately our carbon footprint, I know through the leadership of the National Academy of Medicine, there are a number of our healthcare systems that have signed up to decrease their carbon footprint. And so that research over time will show us, gives us an inkling of how to do it well.
Thank you both. We'll go to our final question.
Hello, my name is Amber Lewis. I'm one of the youth leaders here for NAM. I'm also a full-time grants and contracts administrator, and I'm currently in school to potentially be a phytochemistry researcher in the future. So from my understanding regarding the context of everyone who's in the room, a lot of us have foundations in science as opposed to like sustainability or environmental justice. And from this conference, as well as from all of the experience that I've had within sustainability, whether it be formally through school or otherwise just an extracurricular experience, an idea that I've had, and I guess something that maybe I could challenge everyone else to consider, is that I've grown to view sustainability as, instead of an intersection, as the road that we walk on when we perform our work. I know that Renee mentioned earlier that only about like 50% of the research currently being conducted is impactful, and I could be paraphrasing or misquoting, but I would love clarification on that as well. But a couple of questions that I had, they're very small, but there are two. The first one is, what are you using for your definition of impactful research? And then a second question was, what are some actionable practices you could provide us to take into future research work? So as opposed to thinking of a specific agenda for sustainability research, what are some things, for example, how we learned about the scientific method when we're like very little in school? What is something we can implement in the fundamental steps of research in order to carry out sustainability work in our fields?
Thank you so much. Toddi, would you like to answer first? And then I'll turn to Renee and Maureen.
So I think I love your question about what is impactful research. I think that's really terrific. I think so immediately what popped into my head when you said impactful, there were three projects that popped in my head, and I don't know what the implicit or the explicit definition, but these were projects. There's some great work that Bill Pan, who's at Duke University, is doing up here on migration and malaria, and how humans are vectors in their own right when they're migrating, which I think is really important when you think about equity and how we treat humans. Really important work that we're learning about in Asia as well as in North Carolina on chronic kidney disease of unknown origin, because it's a sentinel climate change disease. It's like one of the first diseases that's emerging at this interface of chemical interaction, heat, and farm workers. Really interesting. And then the last part is just heat in general, how we are seeing communities emerge with locally driven solutions that we are trying to pick up through our Heat Policy Innovation Hub, fund, and share more widely so other communities can pick it up. And so I think in all of those cases, it's impactful because it's either coming from communities or impacting communities more directly.
Thank you, Toddi. Renee, I'll turn to you next.
Yeah, I just want to elevate the great answer that Toddi already gave. I think just to reference the statistic as far as half, I think it was a Pew Research Center study that said that half of the group, that one of the groups that was looked at, which is a Republican-leaning constituent, only half of them thought that researchers were focusing on solving real-world problems. And so I think in that regard, and really taking the previous comment, I mean, we're anchoring our research and our definition of impactful as solving real world problems alongside communities. I think that will help to bring the clarity of the benefits that research and academia and all of this infrastructure really can bring to the lives of every person and meeting them where they are. And so impactful, again, truly is whatever it is that community identified agenda is that's really changing and shaping and improving the lives of those local people. And then in regards to sustainability, I mean, I agree. I think that is a key principle moving forward, but I would also sort of pair that mitigation has to be paired with adaptation. So we have to make sure that we are really meeting the needs that our patients have right now within the healthcare system that go unmet, and making sure that we're pairing that our interventions are also not contributing to the problem and the vicious cycle that's unfolding. So they're also sustainable. So how do we really, again, sort of bring all of these different pieces together around a common problem and starting where you are? And so again, it's looking at what is your healthcare system, what are opportunities that exist and opportunities within the community to start to leverage some of those solutions, and then making sure you're bringing all of those different perspectives to the table as you harness solutions. Maureen?
And so while I use my clinical skills every day, I am a public health professional first, because that's where we make the most impact. And so if the slides I shared, one of my last slides was on precision public health. That's where, just like precision medicine and analogous to that, we focus the solution and therefore the impact razor sharp on the community's needs, just like you would do it at the individual from a precision medicine perspective. So 2 examples in terms of impact. We, over the summer, have high school students, juniors and seniors, to spend the whole summer with us on areas of public health impact research. So they are in communities, working with communities to address issues of farming, to address issues of sustainability, to address issues of air pollution. We had students, for example, measure the temperature differences between the asphalt on the road versus wood chips versus the temperatures in the rooms. And so very early on, we begin to show how research can answer real world problems, but you can't do that by sitting in a building. You have to do that by being embedded in communities. And that's exactly what public health does.
Thank you so much, Maureen. As we conclude, I just would like to give another round of applause to our esteemed panelists. Thank you so much.